Welcome to How to Use DbMotion. Motion consists of a floating agent toolbar which sits over a native application. Here you see it running over Salford's Sunrise Clinical Manager, its EPR system, but when viewed in a GP's practice you will see this running over EMIS or IMPS Vision, depending on which system you currently use. This floating toolbar expands to show each of the domains within DbMotion. All of its clinical information is held within a separate domain which expands to show the details inside. When you hover over the patient's name, which is selected in context with whatever patient is selected in your existing system, you see a tooltip for the data held within your system. The toolbar shows the ability to group or ungroup data, to look at all of the information held within DbMotion or just a delta view, which is the most up-to-date version, to collapse and expand all of the domains that you see below, or to refresh the patient data. These other two buttons, the print and the send to my EHR button, are currently disabled until we have the full implementation of DbMotion's features. Each of the domains opens to reveal the data beneath. It will tell you how long a period of time it's looking for that data, and there is also a funnel menu which lets you group, look at the delta view, search for more data, or expand and collapse all. So if we expand all now, you can see all of the inpatient events and results visits for the current patient held within Salford Royal's EPR. When you hover over each of the events within the domain, you will always see a super tooltip which shows you things like discharge date, where they were discharged to, and this relates to the particular inpatient event that you have highlighted. The problems domain shows all of the current active problems for a patient, and they're grouped in SNOMED order where it's possible to code that information. As you can see here, a patient with abdominal pain, and the super tooltip in this case shows the code and the person recording this information. Within the allergies domain, you can see that some of the allergies are highlighted in red, and this shows where there is a severe reaction to an allergen. As you can see here, this patient has a severe angioedema episode associated with ACE inhibitors, and it was recorded on a previous visit to Salford Royal. Within the medications domain, the drugs you'll see are all current medications that were prescribed on discharge. They're grouped where possible under their SNOMED DMD category, and the super tooltip here shows when the medicine was prescribed, by whom, and the dosage and frequency details. Some drugs will appear under others. For this one, it is a drug level reminder for the gentamicin that they've been previously given. You can choose within the medications domain to look at all medications, and this will show previously cancelled medications as well. So as you can see, these medications that are highlighted now have already been cancelled. On the measurements domain, you will see the clinical observations recorded when the patient left hospital, the last clinical observations that were recorded for the patient. And these consist of the standard clinical observations and their weight, height and BMI. As with all of the domains, you will see a funnel menu with the same settings as shown previously. Within the labs domain, you will see the clinical tests that have been ordered by their clinical specialty. So in biochemistry, as you can see, some of the results are highlighted in red, which indicates abnormality. Again, when you hover over the result, you will see details of the test, and if you click onto the details of the test, you will see the full range of tests within that set. So here you can see a patient has a low estimated GFR, which is causing the U&E to be displayed in red. For other results, such as hematology, you can look at the full blood count and see details of which elements are abnormal, either high or low, and you can view any comments that were recorded by the pathologist carrying out the test. For microbiology, when you look at these tests, you will see the details of the test carried out, and when you click on the date, you can see that an abnormality has been recorded. When you click on the comments or the remarks, you will see the details held within the system and the text report that was sent through by the pathology department. So here we see Clostridium detected. In the imaging domain, this contains details of X-rays that were carried out, CT scans and MRI scans, any kind of radiological investigation. And the report is contained within the little square that you see here, which prompts you to open the report. The report opens in the clinical viewer, and you can see the details that were recorded by the clinician. For the documents, the same is true. These are held in different domains to allow you to find documents easily, and these will contain all of the documents recorded in the EPR system, whether they've been recorded in hospital or by district nurses and other community practitioners. They're viewed in the same way by clicking on the small icon that opens the document in the clinical viewer. This brings us nicely to the clinical viewer itself. The clinical viewer opens in a separate window and gives you a little more detail than you've seen in the agent so far. As you can see, it contains all of the domains that we've seen previously. So it has the encounters domain, which displays with more information than you've seen before. In the agent, it displays the problems domain again grouped by their SNOMED code, and here you can select whether that's over the last 1 year, 5 years, or as long a period of time as we have available. The medications again shown this time over 1 year, and here you can see the details of the drug, and similarly the tests domain and will show the labs, the results history, and the imaging or radiology. If we look in the lab's history, we can now see a different set of results depending on what we select on the items on the left hand bar. So if we're only interested in seeing parts of the clinical biochemistry, we can select those parts that we're interested in and then click on the show button, and that will show any results. Where there are no results in the last 2 months, you can change the criteria to say let's have a look in the past 2 years. And now by clicking show on the filter area, you can see the last result recorded, and if there was a group of results you could see those in a graphical display as well. The clinical documents are visible with a select window on the left hand side that shows all of the documents recorded in the last year. The ones that are struck through are the documents that have been cancelled. There are valid documents which show in a viewer with exactly the same details as you would see in our EPR. That's been a quick tour of DbMotion. Please feel free to replay these at any time. You can always send us some feedback, and if we receive any information from you, the DbMotion team will respond accordingly. Thanks for your time and good luck with DbMotion.